Did you know the prostate cancer is one of the most dangerous types of cancer that men can get? According to the American Cancer Society, the only kind of cancer that affects males more often than skin cancer is prostate cancer. It is estimated that around 1 in 9 men will be diagnosed with a malignancy at some time in their life. It is anticipated that in 2022, approximately 200,000 men in the United States will be diagnosed with prostate cancer for the first time, and that the disease will claim the lives of more than 40,000 men. On the other hand, if it is caught and treated at an early stage, prostate cancer has a lower risk of becoming fatal. Because of this, it is essential for men to be aware of the symptoms of prostate cancer in its early stages. What you need to know about prostate cancer. The prostate isn't something that most men pay much consideration to until it starts giving them complications. It is located under the bladder and surrounds the urethra, which is the tube that transfers fluid to the penis. The tiny gland is important for creating seminal fluid, which is fluid that helps sperm exit a man's body. Cancers that originate from gland cells are referred to as adenocarcinomas, and the vast majority of prostate cancers fall into this category. There are 2 types of prostate cancer, those that develop fast and those that develop fairly slowly. According to the American Cancer Society, some men might have prostate cancer that is undetected for decades without the disease developing any symptoms or complications. On the other hand, the dangers associated with prostate cancer are fairly significant, especially after the disease has spread to other parts of the body. There are symptoms of prostate cancer that can be observed by self-diagnosis. This being said, men should have prostate checkups regularly by a healthcare professional. Here are 10 common warning signs of prostate cancer. Before we get into it, please remember to like and subscribe. Let's get going. Number 10. Pain in your back, hips, or legs. Extreme discomfort may be caused by prostate cancer in the thighs, hips, and lower back. This is caused by the metastatic spread of prostate cancer to the bones in the aforementioned locations. New bone cells are affected by bone metastases from prostate cancer. A study was conducted on male patients with back, neck, and pelvic discomfort. Men with back pain had a 50% greater chance of being diagnosed with prostate cancer than men without back pain, showing a clear relationship between back pain and prostate cancer. In addition to this, men with advanced prostate cancer often complain of limb weakness and numbness. If you feel you have lower back, pelvic, or thigh discomfort owing to an unknown reason, you must see a doctor. Number 9. Frequent nocturia and urination. Frequent urination and nighttime urination are hazardous warning signs when prostate cancer is suspected. Nocturia is the condition in which a person must wake up to urinate throughout the night. Sleep disturbances might worsen a patient's health condition due to repeated toilet trips throughout the night. Nocturia may make a person feel exhausted in the morning. If you are bothered by the number of times you wake up throughout the night to void your bladder, you should see a physician immediately. A bladder diary is regarded as an essential instrument for assessing the severity of the disease. Urinary or fluid diaries need accurate tracking of the patient's 24-hour urine output. Number 8. Blood in the urine. The presence of blood in the urine is known as hematuria. It is only detectable in the most aggressive and advanced stages of prostate cancer. In prostate cancer, 2 distinct kinds of hematuria manifest. Microscopic hematuria is characterized by the presence of red blood cells in the urine that are only visible under a microscope. Red blood cells may be detected with the naked eye in the urine of a patient with macroscopic hematuria. 3 to 5% of prostate cancer patients may exhibit blood in the urine. In this scenario, the color of the urine changes to red or pinkish. This is related to the prostate cancer's invasion of other areas of the urinary system. Kidneys, ureters, and the urinary bladder are the most prevalent sites of infection. Regular urine examinations are essential for accurate diagnosis. Urinalysis, urine cytology, a genital exam, rectal exam, urine culture, and ultrasound are often requested to find the etiology of hematuria. Number 7. Painful or burning urination. The enlargement of the gland caused by prostate cancer disrupts the regular flow of urine. Urine flow obstruction is the cause of painful urination. It is also conceivable that painful urination results from the spread of cancer to neighboring structures. Local invasion of nearby tissues, such as the urethra, bladder, and rectum, is a defining characteristic of prostate cancer. Burning during urination may be caused by a separate infection or by treatment-related adverse effects for prostate cancer. The gland's hypertrophy results in urinary blockage and retention. Infection of the urethra and bladder caused by excessive urine retention may cause burning during urination. Antibiotics may provide temporary relief, but the doctor must begin prostate cancer treatment to prevent future dangers and problems. Consultation with your physician is the most effective method for avoiding the dangers of undetected prostate cancer. Family history and genetics are key risk factors for prostate cancer, but changes in lifestyle and nutrition might amplify these warning signals since obesity can worsen painful micturition. Number 6. Sudden weight loss. Weight loss is connected to all malignancies, including prostate cancer. Appetite loss, nausea, and vomiting are the leading reasons for weight loss. The scientific explanation for these symptoms is still debatable. In addition to appetite loss, prostate cancer patients sometimes notice a change in the flavor of certain foods. If you are experiencing unexplained weight loss, you should visit a physician at once to determine the reason. In order to prevent extreme weight loss, doctors suggest consuming a high caloric intake. Likewise, nausea and vomiting may be managed with the correct medication. The risk of problems might be increased by ignoring these signs. Number 5. Pain in the rectum. The spread of prostate cancer to the rectal area may cause rectal pain due to tumor invasion of the rectum. Constipation, fecal urgency, fecal incontinence, flatulence, subtotal bowel blockage, diarrhea, and other bowel abnormalities might occur. You must see your physician at once in order to treat these symptoms and find their precise cause. Digital rectal examination, ultrasonography, and PSA screening may aid the physician in determining the correct illness etiology. Number 4. Painful ejaculation. Ejaculation that is painful may be detrimental to a person's sexual relationship as well as his sense of self-worth. About 2 to 3% of men will experience excruciating pain during ejaculation if they have prostate cancer. The pain that follows ejaculation may last for more than 24 hours. Individuals have, on occasion, reported experiencing discomfort before ejaculation. Nevertheless, it is far more typical for patients to experience pain post-ejaculation. Number 3. Pain while sitting. Because of the patient's enlarged prostate gland, sitting for long periods of time might be quite painful. Patients who have prostate cancer often complain of discomfort and numbness in the perineal area when they are seated on a hard surface. This kind of prostate cancer, known as prostate adenocarcinoma, is the one that is most often connected to experiencing discomfort while sitting. It's possible that you have prostate cancer if sitting causes discomfort in your pelvic or lower back. Number 2. Problems urinating. Urinary retention in the bladder may make it impossible for those who have prostate cancer to urinate because of the condition. The local invasion of the tumor, as well as an enlarged prostate gland, are the primary factors contributing to the individual having difficulty emptying his bladder. It is strongly recommended that you see a urologist as soon as possible if you find that you are experiencing difficulty while urinating. Number 1. Loss of bladder control. Another potential warning sign is a loss of control over one's bladder. Urinary incontinence is the phrase that is most often used to refer to this problem in the medical field. The symptoms of urinary incontinence might vary depending on the kind of prostate cancer a patient has. The 2 primary forms of incontinence that patients report experiencing are stress incontinence and urge incontinence. Loss of control of one's bladder might be a symptom of a disease's progression. Nevertheless, radiation therapy and prostatectomy are the 2 most common medical treatments responsible for this condition. The prostate has a role in the regulation of the passage of urine from the bladder to the urethra. The inability of the bladder to hold urine, which leads to dribbling and nighttime bathroom trips after a prostatectomy, is performed to halt the progression of prostate cancer, is common. Urinary incontinence might be a side effect of surgery on the prostate because it risks causing damage to the nerves that feed the bladder. Because of the many treatments available for prostate cancer, 25% of men have a loss of control over their bladders. Now that you know some of the symptoms of prostate cancer, are you at risk? Included among the risk factors for prostate cancer are older age. As you age, your chance of developing prostate cancer increases. It is prevalent after age 50. Ethnicity. Black men have a higher risk of prostate cancer than those of other races for unknown reasons. Additionally, prostate cancer is more likely to be aggressive or progress in black men. Family ancestry. If a parent or sibling in your immediate family has been diagnosed with prostate cancer, your risk may be enhanced. Additionally, if you have a family history of genes that increase the risk of breast cancer, 𝐂1 or 𝐏𝐫𝐨𝐬𝐿2, or a significant family history of breast cancer, your risk of prostate cancer may be increased. Obesity. Prostate cancer risk increases with obesity. Additionally, obese individuals are more likely to have advanced disease, which is more difficult to treat. If you have been diagnosed with prostate cancer, follow your treatment plan as prescribed by your physician. Additionally, you may discuss with your physician lifestyle and dietary adjustments that may aid in your fight against the disease. Have you experienced any of these symptoms? If so, get help immediately. Let us know in the comments how we can help you. Thanks for watching. Be sure to like and subscribe to stay up to date with our latest content.